The room tube project started almost a decade ago. A scientist, Yolanda Sibea, started thinking about early osteoarthritis of the knee, how difficult it would be to diagnose it, and started her first project really was to standardize the knee exam.
My focus is really on identifying osteoarthritis at an early stage. And I came to this problem when I was recruiting for a study using standard criteria, and they included X-ray. And I found when I was recruiting patients for that study that the majority of the patients didn't qualify for the study because they had normal X-rays, but clinically they had typical symptoms of osteoarthritis. So I realized that we're missing a huge segment of the population with pain and osteoarthritis that is so early that it's just not captured. So that led me into the research that I'm doing on early osteoarthritis to help diagnose it earlier, predict progression of disease, and predict those who are at high risk of progressing so that eventually we can intervene with appropriate treatments.
The reason for standardizing an examination technique like the knee is that if one physician examines a person and says, I think there's fluid in the knee, and another physician examines the same person at the same time and says there isn't, then what's correct? For research, we need to be able to measure things accurately. And a key part of measuring accurately is doing it in a standardized way, so you always get the same answer.
The standardized examination of the knee requires a 30.5 centimeter goniometer, a tape measure, and adequate bilateral exposure of the subject's knees and thighs. As a general rule, all marginal findings should be recorded as absent or normal.